Okay, so this afternoon, what we try to share with you, it's a little bit our philosophy of work that we synthesized in this publication a couple of years ago that we call the prosthetically guided regeneration. Okay, so it's a way to amplify a little bit the concept of prosthetically driven implant placement to augmentation procedures. And this will be also the topic of a book that will appear, let's hope, next year. And it is a resume of our collaboration since the last 20 years. So our prosthetic goal and our final goal in implantology is really to achieve a perfect integration between our prosthetic reconstruction and the surrounding tissues, the surrounding teeth. And I must say since the beginning that this classification applies not to the immediate socket because we are dealing, of course, we also treat immediate sockets, and the treatment modality is similar to the one that Daniel was presenting this morning. But here we are mainly concentrating our presentation on the heel sides because we still receive many sites, many patients that needs to be treated for heel sites. And so the philosophy of prosthetically guided regeneration starts from a very precise prosthetic project that is able to guide the following steps of treatment, including prosthetically guided implant placement, then bone augmentation procedures, soft tissue augmentation,